we have been discussing different uh, psychological illnesses. Different psychological illnesses. So uh, we talk about the uh, severe type of mental disorders and the mild type of mental uh, disorders or the illnesses. So all these types or the illnesses can be treated. So there are treatments. If you can remember the personality lesson, I told you to find out some personality disorders. So if you can remember, I talked to you that uh, these personality disorders cannot be treated or cannot be yes treated. But there are some measures can be taken to reduce these illnesses. Give me one second. Sorry. So we have been discussing uh, about the uh, different type of illnesses, mental illnesses or mental disorders, and the reasons for those types of illnesses, some characteristics or how to identify those illnesses. Okay, today we are going to discuss about psychotherapies. How to therapies means some kind of treatments. So we try to understand what type of treatments that we have. Uh, when we start this module, I told you that this module is not to treat not to train you to conduct psychological treatments or testings, but to have an overall idea and you to support or the help to become a normal human being in the society or to understand others mentalities, mental disorders or mental status uh, to work together. So this is the purpose of this psychology module. So this will help you to understand the people among you in the classroom or in the workplace or in the family or in the society. So this will not give you the skill or the ability to treat people, skill or the ability to treat a person who is suffering from the mental illnesses. That is not the purpose. So I should clearly mention it because having 20 or 22 time of knowledge, hours of knowledge, you are not be able to treat a person. So at least you yourself cannot get any support with treatment side, but you can have an idea about the treatments or the therapies. So this is the main purpose of this module. So here, with that purpose, we can discuss us about the type of therapies and what type of treatments that can be given to a specific person or mental disorders. So this is the basement. So here I have given you one website. So there are several websites that you can refer. Yeah, right. We'll go to the content. So here I'm uh, explaining what the psychotherapy is. What the psychotherapy is. So here psychotherapy is the way to help people with a broad variety of mental illnesses and emotional difficulties. The psychotherapy is the way, it's a method, it's a technique, therapeutic way to help people. We are helping people. If you can remember the very previous lessons, so I have taught you about the psychologist and the psychotherapist. Can you remember psychologist and psychotherapist or psychology or psychiatry? Can you remember? In the table, I have given list of characteristics, the differences of psychologist and psychotherapist. Like psychiatrist and psychologist. So that is how the way we treat the psychological disorders or the illnesses. If you can remember, we can make this session a fruitful discussion. So if you can remember, you please put your answers to the chat box. So who is the psychologist? Who is the psychotherapist? What are their roles? Psychologist and the psychotherapist. Two different uh, roles. So if you can recall your memory, please put the answers to the chat so that you also can you also engage with some fruitful work. How to help the people. So there are two kind of professions: psychiatrist and psychologist. So did you understand my question? I just want the functions of psychologist and the functions of psychotherapist. Two different professions work together or sometimes work individually to treat these people in therapeutic side. So if you can remember these two functions, put give me the answer using chat, or else you can use you can unmute your microphones and you can talk to me. You can give me your answer. Can you? What is the difference between psychotherapist and the psychologist, or the what are their role in order to treat the patient? Yes.
Psychotherapists are focused to consist to unconscious mind.
Psychotherapist basically focus with their treatments. I couldn't hear you properly, maybe. Psychotherapist or psychologist. What is their role? What is the difference? Basic change. They both treat psychological illnesses. So what they do with those diseases.
Psychiatrists use some no psychotherapy.
Yes, they use some.
Psychiatrists use some medicines to control
Treat.
illness almost.
Yes, yes, very good. I think, yes, your answer is very correct. Psychotherapists, sorry, psychiatrists use medicinal applications, medicines. They are doctors, as I mentioned in our previous session. They are doctors, so they can use medicines, medicational treatments that are used to treat the people. And psychotherapist or psychologists use other behavioral or other therapeutic methods. Right? Can you remember the session? Yes, one answer to me to the chat: psychiatrist, medical professional who prescribe medications to treat mental health. Correct? And psychologists, the mental health professionals who study about psychology, and they not only they do not study only the psychology, but they they also treat to the psychological illnesses using therapeutic methods, and they are not, the psychologists are uh, not a doctor, and they cannot prescribe කියන්නේ අපි ලියනවා ලියලා දෙනවා බෙහෙත් prescription තියෙන ඔන්න prescription, so they cannot prescribe medicines. Okay, psychologist. So you can remember it like this: I am a counselor. I am a psychologist. So you can remember like this: I learned psychology as my first degree. I earned my first degree in the area of psychology. But uh, I haven't learned biological side, or the I don't know what happens in our biological body. So then I cannot treat medicines. I know some medicines to be given to hyperactive children. I know because some idea was given, because if I want to treat some hyperactive children with my psychological knowledge or the counseling knowledge, I have trained, I am specialized it. But uh, only thing I can do is I can use behavioral therapies, but I should be able to identify. I should be able to identify the medicines. For example, if the psychiatrist prescribe some medicine which is relevant to the hyperactive children, I should be able to identify the medicine, not prescribe the medicines, but to understand what kind of diseases that they have, illnesses that they have, right? So I learned psychology and also counseling, and there I have done 1 year diploma in separate institute or the recognized institute in Sri Lanka, and I have been trained as a counselor, most different areas to be given counseling, and I am practicing it. I am a professional counselor. I have an affiliation with some professional counseling organization to ensure whether I am adhering that professional ethics, work ethics and all. So I am a psychologist. As I mentioned earlier, I cannot prescribe medicine. So now you will remember who am I. So then psychologist cannot give medicine. Now I am conducting lectures. I aware the people about the psychological illnesses. I can identify the psychological diseases by looking at the people's behavior, and I know the behavioral treatments, and I can give some counseling to them, and I can use some uh, treatments uh, except medicine, and that is one type of therapy. And the other part is psychiatrist. Psychiatrists, yes, you have given a very clear answer. They are doctors. They are having the background knowledge of the physiology. Physiology is not psychology. Physiology. It right? Physiology. Physiology means the biological knowledge on the human body and their body, the chemistry, biological knowledge. So they know what the what are the functions and the changes of our human body when it comes to mental illness. They know in our brain these areas may be damaged with the depression. These areas may take a different color with the stress or some or some specific organ will damage, will some specific uh, hormones will reduce or decrease or increase with specific mental disorders. So this knowledge they have the psychiatrist having that specific knowledge which related to the physiology of the human biology. And also they have specialized about that psychological knowledge or the different illnesses and different treatments. And they know the different medications, not medication, medical treatments or the medicines. So there are two ways to help people with a broad variety of mental illnesses. That is why I wanted to mention the psychologist and psychologist and psychiatrist. So two type of people together with treat these mental disorders. So this is psychotherapy is the way to help people with a broad variety of mental illnesses. Now, if you can remember our previous sessions, previous discussions, we were taught different type of illnesses. There are hundreds and thousands of mental illnesses. So you know there are new illnesses also occur due to this new pandemic situations. So different type of mental illnesses may occur. So variety of mental illnesses are there. So continuously it develops. So we also subjected to a suffered with a mental illnesses. So if you were asked to stay at home for a long period, more than 1 or 2 months, so what will happen to you? You also start to talk about mental stressors or disorders. අයියෝ පිස්සු වගේ මේ ගෙදරට වෙලා ඉන්න ඕම කියන්නේ ඒක. So this is the truth because in there's a Buddhist saying සබ්බේ සත්තා උම්මත්තක හැමෝටම මොනවා හරි උමතුවක් තියෙනවා. ඉතින් මේක තමයි සර්වකාලීන වූ සත්‍ය අපි හැමෝම ලෙඩ වෙන්න පුළුවන්. So there the variety of mental illnesses are there, different type of illnesses. You may not suffer throughout your lifetime, but for some specific occasions, some specific periods, you may suffer with mental illnesses. So here, psychotherapy is there to treat those different illnesses with different ailments, different methods. Illnesses and emotional difficulties. Two type of things, mental illnesses and emotional difficulties. Nowadays, we are feeling that emotional difficulties. Why? We all heavy rain Ratmalana area. So I wonder whether we will be able to continue our session. I think you may hear the thundering. We'll try to continue a few minutes. If it's growing, we'll stop the session. Okay. There's a thundering.
Okay, madam.
So I will try to continue. If it gets worse, we'll stop. Okay.
Okay, madam.
Actually, when I want to finish my session, do we have some more time, Wilson?
Sorry, madam.
තව කොච්චර දවසක් අපිට තියෙනවද මේ අපි 10ක් ඉෂුව එකක් නැහැ ටයිම් එකේ නේ මට 22ක් විතර ගන්න 30ක් වුණත් ගත්තට කමක් නැහැ කියලා මම කිව්වේ.
ඔව් මැඩම් කොහමත් ඊළඟ දැන් මේ මාසේ තමයි ඉවර වෙනවා කියලා තියෙන්නේ.
ප්‍රශ්නයක් නැහැ නේද අපිට ඒක කන්ටිනියු කරන්න වුණොත් මේ ලැක්ස් වැඩි වුණොත් මම නතර කරන්න.
ඕකේ මැඩම්.
ගොරවනවා වැඩි වුණොත් නතර කරන්න.
ඕකේ.
අනිත් පැයට කොහොමද වැස්ස නැද්ද? මේ පැත්තට විතරද වැස්ස තියෙන්නේ?
නම් පොළොන්නර මෙන්න වැස්ස මොකද?
හරි වහිනවා රත්නලාලට. කමන්නේ අත්වල. ගොරවන්න නැතුව තියෙනව නම් කමන්නේ ගොරව දිබෑන් කරන්න මේ බලමු. Psychotherapy is the way to help people with a broad variety of mental illnesses and emotional difficulties. So way to help people with broad variety of mental illnesses. So we have been talking about different varieties, so different mental illnesses and emotional difficulties. Kind of emotional difficulties cannot be considered as a mental illness because emotional difficulties are the type of uneasiness. Emotionally, we are not perform a good way of behavior, emotional difficulty. So we cannot cope those emotions. Uh, that is the that is the meaning of this emotional difficulty. So sometimes we with loss of our loved ones, beloved parents. Now these days, I was talking. I'm handling two or three different cases which related to pandemic situation. There are some students who have lost their beloved parents or loved ones, family members. So they are suffering with this type of emotional difficulty. So we have to strengthen their emotions. We need to talk with the people who are suffering with this type of emotional difficulty. So with this corona situation, you may lose your family member, close friend, or close family member or loved ones, your father, mother, or relative